At Sunnybrook, we are inventing the future of healthcare. The treatments of tomorrow are happening right here, right now, today. In imaging techniques that find diseases earlier, in treatments that are more precise. In cutting-edge techniques, we teach others here and around the world. In breakthrough medical advances that are saving lives. With your help, we will heal the future. With your help, we are inventing the future of healthcare. So what does the future of healthcare look like?
In cancer, as you know, the earlier the diagnosis, the better that we can treat you and the better you will be in the long term. We've learned to manipulate ultrasound at a high frequency so that the energy from the sound can actually provide treatment. So from imaging to treatment with the same machine. One of the amazing technologies we're doing at Sunnybrook is learning how to use imaging to see how our treatments are working. You can see live in somebody how treatment is actually working. The imaging is showing us how cells are responding in real time. We're seeing if it works now. We can tailor the amount we give you, we can tailor how we give it, and we know if it's working or not while you're getting it. And I think that the most important thing for us is never to abandon good therapy. We just make it better, faster, more effective, and most importantly, more invisible to our patients every day.
What we've done at Sunnybrook that's somewhat unique in the world is that we've integrated the entire Department of Psychiatry, all of mental health, with related programs that deal with disorders of the brain, including neurology, including geriatric medicine, even including neurosurgery. The demographic in Canada is, like many developed countries, tremendous shift of the population towards older age and older adults. And this is going to pose a tremendous challenge to the healthcare system. The Brain Sciences program, in response to this societal need, is focusing on vascular change in the brain that we call stroke, and we're also focused very much on dementia, like Alzheimer's disease. And as part of both of those, we integrate the psychiatric manifestations of these conditions. These are complex diseases, and we need to take a multifaceted approach in order to address them properly. The future of healthcare is now, we're doing it now, but with the development of improved technology, we're just going to get better and better at what we do.
Sunnybrook created an incredibly innovative program that combined trauma, emergency medicine, and critical care. And it's absolutely unique not only in North America, but in the world. Most traumas that we see are preventable. And they're not just preventable by not drinking while you drive or staying away from ladders. They're also made safer by some very sophisticated things like designing better cars, designing better roads. That takes an incredible novel research integration between some people that doctors aren't usually used to collaborating with. There aren't very many times when a trauma surgeon, an intensive care doctor, and a road engineer get to sit down, and that's what we want to create. It's all about speed. We talk about the golden hour. That first hour determines almost everything. What we hope is that the trauma center without walls will save lives. Patients won't move and things will happen faster. If I can bring the imaging to the patient, if I can bring the radiologist to the patient, if I have to, if I can even operate on the patient right there and the patient doesn't have to move. It's all about time.
The important parts of cardiac care now are to look into the future, to try and develop new ways of delivering therapy minimally invasively and without having to do very radical types of surgeries, when you can perform elegant procedures through very small incisions that will enable them to recover quicker and more completely, and to leave hospital and get back to life as soon as they can. The types of valves that we're putting in now in the aortic position, instead of having to do open heart surgery, and procedures we're doing on the mitral valve to try and prevent them from leaking, able to plug huge aneurysms without having to open up huge incisions in their belly and their chest. And my own personal work, what's called chronic total occlusions, by injecting a drug into the occlusions to soften them in order to make them more amenable and facilitate angioplasty in these very difficult to treat arteries. We were very open to looking at many new types of procedures to try and keep at the cutting edge, which is where I think we should be and we have to be.
Birth is a normal process. It's not a medical process, it's not a disease. But sometimes things don't go as we've planned. And if you're going to have a problem, you couldn't be in a better unit than Sunnybrook, because we're in the situation of being able to offer the most specialized care at the most critical times in these patients' lives. Combining research and follow-up care is very, very important. We want to know what the outcomes for these very small babies are. Typically after a baby is born prematurely, they are followed until 2 years of age. Unfortunately, this does not allow for identification of problems that might influence how they adapt into the educational system. We're following our kids up to 6 years. MRI is the state-of-the-art system for imaging brains, and it's very important in premature infants because we know their brains are very, very vulnerable. Right now, adult MRI machines are the only thing that are available in the city, and in fact there are only 2 specially designed neonatal MRI units in the world. What we're looking for at Sunnybrook is to establish the first Canadian neonatal MRI center. My hope for Sunnybrook is that we continue to be leaders in the development of new healthcare strategies, research, and betterment of outcomes for the most vulnerable moms and babies.
We basically have a living classroom. We have a wide range of students who come here, many different health professions and backgrounds. We have students here in medicine who are undergraduate, postgraduate, fellows. We in fact have fellows coming from across the world to learn from some of our expert staff here. Sunnybrook was the first hospital in Canada to have a simulation center. We can actually now use mannequins or components of mannequins to teach surgeons how to do special surgical procedures, minimally invasive procedures, and it's a great way for staff or surgeons, for new students to learn in a very, very controlled environment. We talk about breaking down barriers in education. Our care is provided by teams. Doctors, nurses, other healthcare specialists. We should actually teach that team together. And this is all about learning as a team because you're going to provide care as a team.
Research is the fundament of innovation. Discovery is the fundament of innovation. High-intensity focused ultrasound has also been used for what we call scalpelless surgery. So we have now treated in clinical trial multiple patients with inoperable brain tumors and essential tremors with high-intensity focused ultrasound, and eventually cured them without breaking skin. It's quite remarkable. We have scientists who have now uncovered the developmental cues that will move stem cells into every cell in your immune system. We're able to integrate the research that we do within each of the clinical programs that Sunnybrook shepherds. We need engineers working next to physicists, working next to geneticists, working next to cell biologists, and the clinicians within infrastructure that was designed to enable this interaction. And this is precisely what we have created. We are dedicated to providing the best healthcare available in the world.
By relentlessly pursuing the next life-saving medical invention, we will heal the future. Every day, we will change the outcome for patients. Every day, we will transform lives.
Our patients are really dependent upon us in order to provide the best care now and also the best care in the future. What we are doing is matching our research expertise with that clinical focus and clinical expertise so that we can make the biggest difference for our patients now and in the future.
What does the future of healthcare look like? It looks like this.
Today's discoveries are the treatments of tomorrow.
We are changing the outcomes of our patients.
We're treating the untreatable.
We are seeing the invisible.
We will stop the unstoppable.
We make the inoperable operable.
Life happens here at Sunnybrook.
We are inventing the future of healthcare.